Hello, welcome to my podcast, Medicine Confidential. Anthony Bourdain wrote a book, Kitchen Confidential, which told the backstories of what goes on in restaurants. I'm going to do the same for medicine. I've been a doctor more than 40 years, and medicine is a calling. And I love being a physician, and I love my patients. My friends and patients have warned me that I will be attacked. As Winston Churchill said, you're getting attacked, good. It means you stood for something. I'm a former faculty member of Harvard Medical School and MIT. I'm an electrical engineer as well as a physician. I was formerly chief of retinal surgery at the Joslin Diabetes Center in Boston. In these videos, we will explore the hidden side of medicine. Everybody at some point becomes a patient. During the 40 years I've been practicing, medicine has changed. Unfortunately, not for the better. And it's more important now than ever that you must be your own advocate. It's similar, unfortunately, to when you bring your car to a mechanic. It's a good idea to have an idea what might be wrong with it. Well, the doctors today are not the same as the doctors of yesterday. As late as 20 years ago, I remember being in the hospital physician lunchroom, and we would speak about cases because around the table there'd be doctors from different specialties, internal medicine, infectious disease, surgeons, and people would bring up cases that were interesting or difficult, and we would all discuss them. Now, the doctors speak about how unhappy they are, or electronic medical records, or trying to get paid from insurance companies. The doctors now, many are hospital employees, and they're not happy. There are times when they see patients, there's a chip in their badge, and they don't have time, and they're reprimanded if they spend too much time with the patient. Well, an integral part of medicine was taking a good history, was listening to the patient. Most recently, I was speaking with my contractor who told me that he's had 13 operations by orthopedic surgeons. And I spoke to him about this. Really? I mean, you're a young man. Why? And he went through the litany of operations and also mentioned that he had a piece of intestine removed for diverticulitis. And I said, you have Ehlers-Danlos syndrome. And he had never heard of it. But the doctor who operated on him 13 times should have heard of it because he went for physical therapy and they did dry needling and he said he was paralyzed for 3 days. Well, that's what can happen with people with that syndrome. But it's like going into McDonald's. You get a burger. That's it. You can say you want it medium well, you want it rare. It doesn't matter. This is what you get. And that's what medicine has come to now. It's all about numbers. It's not a fine restaurant, it's a fast food restaurant. And you're treated as such. When you went to your physician for your physical exam, did he even look at you, or was his face buried behind a computer screen? Because he was typing all kinds of things into the electronic medical record. Now, I get records from all around the world because I am doing very specialized surgery, which I'll discuss in a later episode. And most of the records are garbage. There's 20 pages of nonsense. What your hobbies are, Um, I've seen women who have had normal prostate exams listed in the record, and men with negative pregnancy tests. And once it's in the record, it's memorialized for all time. And let me ask you a silly question. If you had an STD, does your eye doctor really need to know that? And he might tell your wife. I mean, if it's just ridiculous. Who gave the drops? What time they gave the drops? We're memorializing nonsense. And why? Well, it's for the insurance companies. They don't read the notes, they just weigh the notes. And the government and Medicare, it's all documenting everything. The old line is if you didn't document it, you didn't do it, which is nonsense. I didn't write down that I shaved this morning, but I did. Then you can see it. There was a case in Massachusetts where ophthalmologists were opening the back wall of the capsule after cataract surgery. It's called a YAG capsulotomy. And apparently, the regulation was you had to take the patient's temperature, which has nothing to do with anything. What happened? Medicare went after all the doctors and got the money back for the surgical procedure. I mean, just complete stupidity. The US spends the most of any nation on earth on healthcare, and we have among the worst healthcare for the majority of citizens. Now, you need to know the rules of the game. One thing is you're not the customer anymore. You're not paying the physician. The insurance company is. So that's who they play to. The doctor isn't in charge. He's just a tool of a drug company, of an instrument company, of the insurance company. And when reimbursements are so low, I've seen an insurance company pay 70 cents for a blood test. Well, you needed somebody qualified to take the blood. It takes time. You have to hire somebody to do that. And you use a butterfly needle and you use tubes and you have to send it out. I mean, it's just ridiculous. They're paying less than what it costs the doctor to do, which is why most doctors don't take blood anymore in their office. They send you to a lab. When you call to make the appointment, you're on hold for 40 minutes. Your call is important to us. If it was important, somebody would answer the phone. I closed my practice, my regular practice, in 2018 because the regulations and the bureaucracy got to be so ridiculous. The time I spent with patients is what was important to me and my patient. And that's what the patient cares about, not the backstory of pages of garbage. I remember when Medicare wanted you to uh, fill out certain papers and send in certain reports, and they would pay you for that. Well, what happened? I did all that. I never got paid. There's nobody you can protest to. You just don't get paid. In my office, the staff would answer the phone on the second ring. I would periodically call in to make sure that happened. When I tried to make an appointment recently, I was on hold for 40 minutes. My call was important to them, and then they cut me off. It took 3 times, and I got called back a day later. I went to see the doctor. It was an hour and a half in traffic from my office. It should have been 35 minutes, but it was an hour and a half. I sat in his office for over an hour. I went to the front desk and said, I'm waiting a long time. What happened? Oh, he's caught in traffic. He'll be here in another 40 minutes. I said, I was caught in traffic. I just left early to be here, and this is ridiculous. So I walked out. An hour and a half later, the doctor called me Didn't really apologize, but he wanted to know my height, my weight, my this, my that. We talked about why I had come, and I got a bill for an office visit. I noticed that his office was owned by a company, private equity company. And that's one reason why you get treated as poorly as you do. What does this mean? It means a company buys the physician's practice, and the first thing they do is they cut staff. And the second thing they do is they pile on patients because it's about making money. When I had my office, I tried to keep to a schedule. When I was at Harvard, in order to make money, they would book 3 patients for 8 o'clock, 3 patients for 8:15, 3 patients for 8:30. The joke was that the patients bring a copy of War and Peace, and I resolved never to do that. So in my office, I would take patients when they were supposed to be seen, when they made their appointment. And if there was a delay because there was an emergency or something, I would send one of my office workers to the waiting room to apologize and explain to them what was going on. We answered the phone and we treated people the way I wanted to be treated. Unfortunately, that can't exist anymore because as reimbursements, they cut and cut and cut, and they pay you less than the service is worth. It's impossible to do that anymore. Now it's a question of numbers. McDonald's has to sell a lot of hamburgers. You can't just sell a couple to make money. Same reason it takes 10 days to get your results back for a test. You may be on pins and needles wondering if you have cancer or not, but you still have to wait 10 days because the results are sent to some lab somewhere, or the x-rays are read by somebody else somewhere far away. I heard of one hospital that has their x-rays read by radiologists in India. Now, what recourse do you have if it's misread? And how much does that radiologist in India really care? And if they're killing him by sending him hundreds of x-rays each day, how can he really do a good job? You're not going to see Marcus Welby or Albert Schweitzer anymore because they could not survive practicing medicine. I saw this change coming more than 20 years ago when physicians were called providers and not doctors by insurance companies. That's the first thing you do is you dehumanize somebody. I'm a provider at my house when I bring food home for my family. I'm a physician. Even the lowest politician is still called sir or your honor. Years ago, private companies bought physician practices, and you know what happened? They went out of business. Even today, these private equity companies have bought hospital chains. And what they do is they sell off the real estate, they sell off everything, they cut staff. And there was an article I read that deaths in the emergency room went up. And then you know what happened? The company went out of business. But so what? They made a ton of money. You aren't the customer anymore. It's like board at your college. The university is the customer. They're the ones paying the bill. The best and the brightest are no longer entering medicine. They're going into business or some other fields. I mean, for somebody to become a physician and they wind up with over $200,000 of loans and then they get a low salary and they can't open a practice because it's too difficult and too expensive. So they go to work for a hospital, and that's what happens now at for-profit hospitals. They're hiring employees and they can work them to death. Um, During COVID, the hospital talked about how great the hospitals were. As soon as COVID ended, they cut their salaries tremendously, and most of them left. But some had to stay because their family was there and the kids were in school. You must be your own advocate. You must do research. You can't blindly walk into the doctor's office. That's why drug companies advertise on television, because the doctor doesn't have time to talk to you. So if you see a drug on TV, you could say something and bring it up. And he'll quickly write you the prescription, whether you should get the drug or not, because you have to leave with something. If you leave with nothing, then you don't think the doctor's a good doctor. I read an article that for every dollar that the drug company spends on advertising, they reap $2. So it's a good deal. That's why you see all these ridiculous ads with people dancing around. I mean, if you have certain medical conditions, I wouldn't be dancing around, but they're appealing to the patient. I'm going to continue each week with a different subject. I'm going to discuss innovation and research, heroes in medicine, how to deal with insurance companies, drug prices, academic organizations and universities, my research, lying to make money. I think you'll find that funny. Medicare, the AMA, the government, hospitals, and more on doctors. I hope you enjoy this, and I welcome your questions. Thank you.